Hello sir, my name is Akshat Sharma, a student of B Farm 5th semester, School of Pharmaceutical Education and Research, Jamia Hamdard University, New Delhi. Today I will be presenting on the topic adverse effects of long-term androgen therapy. Before we go to our presentation on adverse effects of long-term androgen therapy, let us understand what are androgens. What are androgens? Androgens are a group of steroid hormones responsible for the development and maintenance of male characteristics in the human body. Basically, androgens are a group of steroidal hormones and they are responsible for the development and maintenance of male characteristics in the human body. They are the primary male sex hormones. They are basically primarily male sex hormones, although they are also present in females but in a small amount, in small quantity. The main androgen is testosterone. The main androgen is testosterone, while others include dihydrotestosterone (DHT) and androstenedione. Androgens are synthesized mainly in the Leydig cells of testes in males. Basically, in males there are a pair of testes. In a pair of testes there are Leydig cells present in the testes, and in Leydig cells androgens are synthesized. And in ovaries in females. In females there are a pair of ovaries. In females, there are a pair of ovaries in which androgens are synthesized in ovaries in females. These hormones play a crucial role in development of male primary sexual characteristics. Basically, these hormones play a crucial role in the development of male primary sexual characteristics. Secondary sexual characteristics such as muscle mass, building up of mass in the body, muscle mass, deep voice, deepening of voice, and facial hair growth. Spermatogenesis, in the production of sperm, androgens play a crucial role. Anabolic effects such as increased protein synthesis, they increase the protein synthesis, and bone growth. They are also responsible for the development of bone growth. Now, regulation of libido and mood. They are also responsible for the regulation of libido and mood. Now let's talk about introduction to androgen therapy. When we talk about introduction to androgen therapy, first of all we discussed about therapeutic scope. What are the therapeutic scope of the androgen therapy? So basically, androgen therapy involves the use of testosterone and its synthetic derivatives. Basically, for the androgen therapy, we use testosterone and its synthetic derivatives. It is primarily indicated for hypogonadism. Hypogonadism is the condition in which there is low level of testosterone in males. However, its misuse in supraphysiological doses, anabolic steroids, is a major concern. However, its misuse in random doses, anabolic steroids, is a major concern. When we talk about mechanism of toxicity, so in the mechanism of toxicity, what is the mechanism of toxicity? So basically, adverse effects arise when there is stimulation of androgen receptors in non-target tissue. So in the body there are non-target tissues. In that non-target tissues, when there is an stimulation of androgen receptors in non-target tissue, adverse effects arises. Second one, there is conversion to estrogens. Basically, there is conversion to estrogen means the androgen which is present in our body is converted into estrogen and its aromatization, by which adverse effects arises. And hepatic metabolism of alkylated compounds. There is hepatic metabolism, which is the metabolism which is occur in liver of alkylated compounds. By this, adverse effects arises. Long-term use disrupts homeostatic axis. So basically, there is long-term use of these androgens disrupt our homeostatic axis. Now, categorization of adverse effects. When we talk about how the adverse effects are categorized, so basically adverse effects are categorized into three categories. Number one, virilizing effects. Number two, effects, and number three, toxic and metabolic. When we talk about virilizing effects, in the virilizing effect, what we study, so in virilizing effect, masculinization symptoms primarily seen in women. Basically, there is an masculinizing symptoms means man's-like symptoms which is appear in women and prepubertal children due to androgenic activity. It means young children activity is there due to androgenic activity. When we talk about its effects, so in effects, what we study in effects, paradoxical effects in men caused by the peripheral conversion of excess androgen to estrogen. When we talk in the previous slide that excess amount of androgen is converted into estrogen. So there is basically what? There is a conversion of androgen to estrogen, which is an adverse effect. So, paradoxical effect in men caused by the peripheral conversion of excess amount of androgen to estrogen. And toxic and metabolic. In the toxic and metabolic, there is direct organ damage. Direct organ damage, which includes liver, heart, and systemic metabolic disturbances resulting from chronic exposure. It means in the toxic and metabolic effect, direct organ damage. It leads to direct organ damage like liver, heart, and systemic metabolic disturbances also seen, which results from chronic exposure. Now, first of all, we discuss about virilizing effects in women, impact of androgenic stimulation on female physiology. It means what does androgen do in the female? So, first of all, hirsutism and acne. Hirsutism, growth of terminal hair in male pattern distribution, face, chest, back due to stimulation of hair follicles. Basically, in the female body, there is a growth of hair in the female body on the face and chest and back due to stimulation of hair follicles like in males. Acne vulgaris. Acne vulgaris means hypertrophy of sebaceous glands and increased sebum production lead to severe acne. It means there is increased in number of cells of sebaceous glands. When there is increase in number of cells of sebaceous glands, then there is increased sebum production, which leads to severe acne in the skin. Male petal baldness. Male petal baldness means paradoxical recession of hairline and thinning of scalp hair. Androgenetic alopecia may occur in susceptible individuals. It means male pattern baldness is also seen in women, in which there is a thinning of scalp hair, androgenetic alopecia. Now, irreversible virilization. Irreversible virilization is the condition in which the symptoms are not reversed, in which deepening of voice. In the deepening of voice, androgens causes thickening and lengthening of the vocal cords. Basically, they are causing thickening and lengthening of the vocal cords. This change results in a hoarse, deep voice, which is often irreversible even after cessation of therapy. It means in the deepening of voice, androgen causes thickening and lengthening of the vocal cords. They basically cause thickening and lengthening of the vocal cords. This changes results in hoarse, deep voice. This results in hoarse, deep voice, which is often irreversible, which is not reversible even after cessation of therapy. Reproductive changes. In the reproductive changes, suppression of gonadotropin release. It means in the reproductive changes, there is suppression of gonadotropin release like LH and FSH leads to amenorrhea. Amenorrhea is the condition in which there is absence of menstruation or menstrual cycle. Clitoral hypertrophy. Clitoral hypertrophy means increase in number of cells, so there is clitoral enlargement. Atrophy of breast tissue. There is decrease in cell size of breast tissue. Now, feminizing effects in men. There are some female effect which is seen in men, paradoxical response to excess androgens. Gynecomastia. Gynecomastia, pathophysiology. Gynecomastia is the benign proliferation of male breast glandular tissue. Gynecomastia is the benign proliferation of male breast glandular tissue. It is a condition in which there is enlargement of the breast. In the male, this condition occurs. This condition occurs due to the peripheral conversion of aromatization of excess testosterone and androstenedione into estradiol and estrone. It means it occurs due to the peripheral conversion and aromatization of excess amount of testosterone which is present in the male body and androstenedione. It is converted into estradiol and estrone. It means estradiol and estrone are the forms of estrogen, and estradiol is the most potent form of estrogen. So, when there is conversion of testosterone and androstenedione into estrogen, so there is basically increased amount of estrogen in the body, and there is benign proliferation of male breast glandular tissue. The altered androgen to estrogen ratio stimulates breast tissue growth. So when there is alteration in the conversion of androgen to estrogen ratio, there is stimulates breast tissue growth. Can be painful and socially distressing. It can be painful and socially distressing. Now, gonadal suppression. Gonadal suppression means FS and LHS level is low in the body. First of all is testicular atrophy. Testicular atrophy, we know that about atrophy. Atrophy is the decrease in the size of the cell. So exogenous androgens exert strong negative feedback on the hypothalamus and pituitary gland. Basically, exogenous androgens which are present in our body exerts strong negative feedback on the hypothalamus and pituitary gland. This reduces the endogenous GnRH, LH and FSH secretion. When there is decrease in the secretion of GnRH, LH and FSH, which leads to shrinkage of testes. They leads to shrinkage of testes due to lack of stimulation. Infertility. In some cases, infertility is also seen. In the infertility, the suppression of intratesticular testosterone. There is suppression of intratesticular testosterone. Intratesticular testosterone is the testosterone which is present within the testes. So, the suppression of testosterone which is present within the testes and FSH leads to oligospermia. Oligospermia is the low sperm count or azoospermia. This results in temporary or potentially permanent infertility depending on duration of use. Now, hepatotoxicity. Hepatotoxicity, with the name hepatotoxicity means hepato, it means it leads to hepato means it belongs to liver, and toxicity means toxic effect in the liver. Hepatotoxicity, liver damage associated with 17 alkylated androgens. 17 alkylated androgens are basically alkylated androgens which cause liver damage. So in this case, we have cholestatic jaundice. When we talk about cholestatic jaundice, so in the cholestatic jaundice, what are the risk factors? So in the cholestatic jaundice risk factors, liver toxicity is most strongly associated with 17 alkylated androgens. So liver toxicity is most strongly associated with 17 alkylated androgens. For example, methyl testosterone, oxandrolone, which are orally active but metabolically taxing on the liver. It means liver toxicity is most strongly associated with 17 alkylated androgens. For example, methyl testosterone, oxandrolone, which are orally active but metabolically taxing on the liver. Cholestasis means bile flow obstruction leading to accumulation of bile salts. There is bile flow obstruction which leads to accumulation of bile salts in the liver. Symptoms: yellowish of skin, eyes, purplish, fatigue. It means it leads to jaundice. Reversible upon discontinuation if caught early. It is reversible if it is caught early, it is discontinued. Okay. Now, severe hepatic complications. In severe hepatic complications, we have pleosis hepatis. In pleosis hepatis, a rare condition characterized by the blood-filled cyst within the liver, rupture of these cysts can lead to life-threatening internal hemorrhage and liver failure. It means it is a rare condition in which there is blood-filled cyst present within the liver. There is blood-filled cyst present within the liver. These cysts, when rupture, they lead to life-threatening internal hemorrhage. They lead to internal hemorrhage in the liver and liver failure. Hepatic neoplasm. Long-term use is linked to an increased risk. Long-term use is linked to an increase of hepatic adenoma. Hepatic adenoma, benign but risk of rupture. A hepatic adenoma is type of cancer which is benign in nature but risk of rupture is there. Hepatocellular carcinoma. Hepatocellular carcinoma is malignant liver cancer. It's a malignant liver cancer and it is dangerous, especially with prolonged high dose therapy when it happens. Now we have cardiovascular system effects, impact of health and impact of in the cardiovascular system effects, impact on health, heart health and hemodynamics. So it is one of the adverse effect of long-term androgen therapy. Cardiovascular system effects, impact on heart health and hemodynamics. So first of all, lipid profile and atherosclerosis. When we talk about lipid profile and atherosclerosis, dyslipidemia. Dyslipidemia is the condition in which there is imbalance of lipid in the human body. HDL suppression, significant decrease in high density lipoprotein, good cholesterol. There is significant decrease in the HDL cholesterol, high density lipoprotein, good cholesterol. LDL elevation, increased in low density lipoprotein, bad cholesterol is increased. So there is condition of dyslipidemia, imbalance between HDL and LDL. This unfavorable ratio accelerates atherosclerosis. This unfavorable ratio is accelerating atherosclerosis. It means deposition of plaque inside the blood vessels. Increase the risk of coronary artery failure. Increase the risk of coronary artery diseases, myocardial infarction and stroke. Now hemodynamic changes. What are the hemodynamic changes you see? Edema. Edema is basically salt and water retention leading to swelling. There is excess amount of body fluid retained in the body. It means salt and water is retained in the body which leads to swelling. Cautions use required in the patient with congestive heart failure or kidney disease. Hypertension. When there is increased blood volume, there is hypertension is also seen. It means hypertension, fluid retention and vascular changes can exacerbate or precipitate of high blood pressure. Polycythemia. Polycythemia is a type of cancer you can see. Increased erythropoietin stimulation RBC production. So increased erythropoietin, which is when the erythropoietin is increased, it stimulates the RBC production. So there is increase in the amount of RBCs in the blood. High hematocrit increase blood viscosity and clot risk. High hematocrit increases blood viscosity and clot risk. Now we have musculoskeletal and growth effects. What are the musculoskeletal and growth effects seen? Impacts for children and adolescents. Impacts for children and adolescents. Premature epiphyseal closure. In the premature epiphyseal closure, stunted growth. Stunted growth means in young children, androgens accelerate linear bone growth. In young children, androgens basically accelerate linear bone growth, but also cause rapid fusion of the epiphyseal plates. They also cause rapid fusion of the epiphyseal plates, growth plates. If fusion occurs before full height potential is reached, it results in permanent short stature. It means if this rapid fusion of epiphyseal plates occurs before full height potential is reached, it results in permanent short stature. But it requires strict radiological monitoring of bone age. It also requires strict radiological monitoring of bone age every 6 months if therapy is essential. So it requires strict radiological monitoring of bone age every 6 months if therapy is essential. Psychiatric and prostate effects. What are the psychiatric and prostate effects seen? Psychiatric effects: roid rage. It is also known as roid rage. Aggression, increased irritability and anger. Mood swings, mania. It is a condition in which there is an disorder of something not memorized. So mood swings mean mania. Mania is basically the disorder of memory retention, mania, hypomania, or severe depression upon withdrawal, Dependence, psychological addiction potential with high dose abuse. When there is high dose abuse, so in the dependence, psychological addiction potential with high dose abuse. When there is high dose abuse, so there is psychological addiction potential with high dose abuse. Prostate health. When we talk about prostate health, so there is a condition of BPH, benign prostatic hyperplasia, urinary retention, inability to flow urine from the urinary bladder. So there is condition of BPH is seen in the patients. Cancer does not cause cancer but stimulates growth of existing prostate cancer cells. It does not cause cancer but it stimulates the growth of existing prostate cancer cells. Absolute contraindication. Thank you.